refill their medications or don't even have money to buy the prescriptions that their providers prescribe them at the visits. So, research questions. Are patients who report higher self-efficacy for chronic disease management or more proactive behaviors with the medical encounters more likely to take their medication? So based on past research, our research question is this, and this is within the medical encounter likely to take their medications. So this is an interesting question to us because these are things that can affect health coaching. So the methods that we used from between April 2011 and April 2012 were surveys conducted in 2 San Francisco safety health clinics with 441 patients who had uncontrolled diabetes, hypertension, and hyperlipidemia. The survey measured medication adherence, self-efficacy for chronic disease management, proactive behaviors, and 357 of the participants took at least one prescription medication and therefore were included in this analysis of medication adherence and its predictors. So going to results. Because of limited time, I'm just going to look at 3 important ones that relate to medication adherence. So if we look at the second line, primary language, you notice that 69% primary language for patients are Spanish. And the one after that is country of birth, which is 75% born outside of the U.S. And then if you go down to the bottom, the third line up, which says household income less than $10,000 a year, is 61%. So for language, we notice the primary language is 69%, so that also includes a language barrier and medication visits, medical visits. And then the county of birth, 74% outside of the U.S. But if you notice household income less than $10,000 a year is 61%, which is pretty high, meaning they might not have medication, they might have money to buy the medications, but other necessities such as food, or they have a family to provide for. And these results are study measures in the mean. So if we look at self-efficacy for management of chronic disease, we see that the mean is 7.7, and the scales from 1 to 10. Scale being the lowest number of self-efficacy, and 10 being the highest number for self-efficacy. So 7.7 to 10 is moderate to high self-efficacy measure. And then if we look after that, we see proactive behaviors during the medical visit. The mean is 3.7, and the scales from 1 to 6, 1 being the lowest and 6 being the highest. And we see 3.7 is actually right in the middle. But then after that, we see medication adherence. The mean is 3.7, and the range is from 1 to 4. So actually, 3.7 is closer to 4, 1 being the lowest and 4 being the highest. So there's actually moderately high medication adherence. So I'm going to take you back up to self-efficacy again, and we'll see Cronbach alpha, the symbol right underneath range. And Cronbach alpha is how well scales stick together. So we usually like to see numbers range from 0 to 1, and we notice for self-efficacy is 0.78, and then for proactive behaviors is 0.75, and medication adherence is 0.67. So this is actually really good because the larger the number means that the patients answered their questions consistently. And then we see for more results, self-efficacy for chronic disease management and proactive behaviors within the medical visit were positively correlated with medication adherence, such that greater self-efficacy and more proactive behaviors were associated with better medication adherence. So we see medication adherence and self-efficacy for management of chronic disease, and medication adherence for proactive behaviors and medical visits are significantly correlated. And here are more results. So back to self-efficacy and proactive behaviors within the medical visit remain significantly associated with medication adherence, even after controlling for age, ethnicity, gender, and income. This is actually linear regression, which enables us to control for other factors such as race, ethnicity, and gender. And if you notice, the top two, where it says proactive behaviors and self-efficacy, we still notice that they are still significantly correlated. So discussion. We found that having a greater self-efficacy for chronic disease management and being more proactive during medical visits were both significantly associated with medication adherence. So putting this into practice, self-efficacy and proactive behaviors are things that we can influence through health coaching. And I am a health coach at a Mission Neighborhood Health Center, and as a health coach, I believe that this is true because patients with a higher self-efficacy tend to ask more questions during the visit. For example, the provider passes them a prescription, they may ask, what is this used for, why am I prescribed a higher dose, or what kind of side effects does the medication have? Limitations. So, reliance on patient-reported measures. This could overestimate medication adherence, for example, may not be generalized to all patients. So participants were enrolled in the study based on uncontrolled diabetes, hypertension, or hyperlipidemia. Participants have low educational level and limited income. These are cross-sectional results, so baseline measures. So directions of causality are not clear. And in conclusion, patients who are more confident in their ability to manage their diseases or navigate the medical encounter are also more likely to adhere to the medications. Additional studies are wanted to test if interventions to increase self-efficacy and active participation in the medical encounter may increase adherence. And the health coaching study still is in progress. And I'd like to thank my team, everyone in the health coaching study, including Mission Neighborhood Health Center, and also Southeast Health Center.
This talk is open for questions and discussion.